This is Pet Life Radio. Let's talk pets.
Welcome to ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm a board-certified emergency critical care specialist and toxicologist. Thanks for joining us today. Today, we're going to be talking about pink eye. We'll be right back after these messages.
Does your dog itch, scratch, stink, or shed like crazy? Come to Dynavite for help.
Order a 90-day supply of Dynavite.
Dynavite for life.
Pick up 2 tubes of Doggo Suds.
Get the 3rd tube free.
Peppermint, tea tree, lavender, Doggo Sud shampoo.
Made with all-natural coconut, jojoba, aloe. Great for healthy skin and soft, shiny coats.
But no itchy, harsh chemicals.
Lather up, rinse away.
Try Doggo Suds. Buy 2, get 1 free.
At Dynavite.com.
DINOVITE.com.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. You heard me right. We're going to talk about pink eye today. And no, it's not in your toddler or child. We're going to be talking about pink eye in dogs and cats. Yes, dogs and cats can get pink eye, but most of the time it's just cats that get it. The true medical word for pink eye is actually conjunctivitis. I know it's a mouthful, so most of the time we just call it pink eye. Thankfully, cat pink eye isn't typically contagious to you, but it is highly contagious to other cats. Now, if you have a toddler who's in daycare, you probably have gotten pink eye yourself from your toddler. So human pink eye is very contagious to other humans. But thankfully, human pink eye is rarely contagious to dogs and cats. That said, conjunctivitis is the most common ailment that affects cats' eyes at some point in their life. Just like human toddlers, pink eye in cats is more common in younger kittens than older cats. So first of all, what exactly is conjunctivitis? Well, it's more than just a mouthful. It's inflammation of the mucous membranes, which is the soft, moist lining of the inside surface of your cat's eyelids. The conjunctiva typically acts as a protective wrap around the eyeball, and it helps lubricate the eye. It actually contains natural antibodies that help fight off eye infections too. But if your cat or your kitten is exposed to certain factors, your cat can develop conjunctivitis. Now, the main causes of conjunctivitis are typically viruses like herpes virus or calicivirus. It can be bacteria such as mycoplasma or chlamydia. Sometimes environmental factors like dust, pollen, spring cleaning, or irritants can cause it too. And rarely, systemic diseases such as feline leukemia or feline immunodeficiency virus, FIV, kitty AIDS, can also cause it. So how do I know if my cat has pink eye or not? The most common signs of conjunctivitis in kittens or cats are typically squinting, redness of the color of the inside of the eyelids, a lot of discharge from the eyes. So if you notice a lot of green, gray, or watery discharge from the corner of your cat's eyes, frequent blinking, swollen eyelids or tissue around the eye, or if the third eyelid is elevated. Now, most pet owners don't know that their dog or cat has a third eyelid, but this is a hard piece of tissue that has a piece of cartilage in it that oftentimes stays hidden. It's not until there's an eyeball problem or if there's an underlying health problem where the third eyelid becomes elevated, but it looks like a triangular piece of white to pink tissue that's coming out of the inside corner of the eye. Now, most of these signs of conjunctivitis are really similar to other eye problems that we can see in dogs and cats, including more severe eye problems like corneal ulcers. In other words, when your dog or cat has a scratch on the glass-like surface of the eye. It could also be clinical signs seen with corneal perforation. That's when the cornea has actually ruptured. Sometimes uveitis or inflammation of the inside of the eye glaucoma, or other eye problems can cause similar signs. So when in doubt, you always want to get to a veterinarian or a board-certified veterinary ophthalmologist as soon as possible to get your cat's eyes checked out. The sooner you bring your cat to the vet, the sooner we can diagnose how severe the injury is. It's really uncomfortable to have eye pain, and I should know because I've had dry eye before and medical problems with my eyes. So we don't want our cats to be in any discomfort. So get to that vet or ER vet right away. We'll continue with this really important topic right after these messages from our sponsors. You've heard the saying, music soothes a savage beast, right? Well, it's true. If your fur baby is experiencing symptoms of stress and anxiety, such as dogs cowering in fear from fireworks or loud noises, destroying clothing or furniture, excessive barking, or separation anxiety, then you want to check out Whole Tones. Whole Tones is a solution where you get a home speaker that you just plug in, and it's preloaded with over 50 minutes of specially composed original music. The Whole Tones solution provides total peace for your pet without any potential side effects of drugs and tranquilizers. Provide music to your pet while you're away at work. It's safe, effective, and guaranteed to work or your money back. Visit WholeTonesForPets.com and use promo code VET, that's V-E-T, to receive $10 off. That's WholeTonesForPets.com and promo code VET.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. We're talking about pink eye, which is mostly seen in cats. Again, not contagious to you, but highly contagious to other cats or kittens in your house. So before you adopt a new cat or you foster a new kitten, please make sure to talk to your veterinarian about the potential dangers of conjunctivitis in cats. We've talked about some of the clinical signs, the biggest one being squinting or swollen eyelids, where the eyes look extra pink, again, hence why it's called pink eye. Now, which cats get conjunctivitis? If you just recently adopted a kitten or a cat from an animal humane society or a rescue, you may notice him sneezing more from an upper respiratory infection, or what we call a URI. In a previous episode of ER Vet on Pet Life Radio, we've discussed URIs, so definitely make sure to check it out. That said, URIs oftentimes can have a secondary complication, and again, that's pink eye. While any aged cat can get conjunctivitis, to be quite honest, it's more commonly seen in cats that just got rescued or were living at a shelter or a multi-cat household or cattery. Immunosuppressed cats, again, those with systemic diseases like feline leukemia or kitty AIDS, are also at increased risk for conjunctivitis. Now, I will admit, in the ER, most of the time when I do see pink eye in cats, it's usually cats that are less than 3 to 5 years of age, really young cats that oftentimes have a more immature immune system. Older cats, thankfully, will sometimes develop immunity or protection against pink eye. So, how do we treat pink eye? Now, before you reach for any random eye ointment in your household, please do not reach for any random eye ointment that may have been used on a previous cat or dog. That's because sometimes using the wrong medication can make the pink eye worse. Now, you also don't want to reach for triple antibiotic in cats. That's because cats can rarely have a severe allergic reaction, or what we call an anaphylactic reaction to triple antibiotic ointment. So most of the time in cats, I'm using medications like erythromycin or other tetracycline topical eye medications instead. When I treat conjunctivitis, there's a couple things that I need to do first. When in doubt, again, get to your vet or your ER vet, as severe cases of URI can result in corneal ulcers where the eye can actually rupture. And again, these clinical signs look really similar to conjunctivitis in cats. When I see a cat squinting or developing that pink tissue that may be swollen around the eye, I typically have to do a couple of eye tests. The first one is called a fluorescein stain. This is when I actually put a drop of a non-painful orange to green dye that temporarily stains the surface of the eye, the cornea. And then I'm going to use a special light to look for any kind of ulcers or damage to the cornea. If I don't see any evidence of a corneal ulcer, then I'll use a topical medication like erythromycin, an antibiotic, or I may even use a small amount of steroid to decrease inflammation in the eye. With uncomplicated cases of pink eye, I usually will treat it with that antibiotic ointment or eye drop, but that needs to be given 3 to 4 times a day for 1 to 3 weeks until the clinical signs resolve. In more severe cases of pink eye in cats that may be due to an upper respiratory infection or viral infection, sometimes I'll even use topical antiviral medications. These are a bit more expensive, but can be really helpful if the conjunctivitis is due to an upper respiratory infection from a virus. Again, most importantly, please do not reuse any type of eye medication that wasn't prescribed for your cat or your dog without checking with your veterinarian, as again, certain types can make your cat's eye worse. More importantly, how do I prevent pink eye? Because younger or immunosuppressed cats are more at risk, it's really important to make sure that your cat is up to date on their vaccines. What does that mean? If you just adopted a kitten, depending on how old that kitten may be, they typically need at least 2 to 3 FVRCP vaccines 3 to 4 weeks apart until they get at least 2 to 3 vaccines. This is really important. Just one vaccine doesn't protect them. That first vaccine actually stimulates the immune response to respond to the second vaccine. So that second vaccine is really important because it's going to stimulate the immune system and protect your cat. So remember, a lot of these viral infections can be prevented by vaccination. It's also important to keep your cat indoors, depending on where you live. This is especially important if you live in an urban environment, so your cat isn't susceptible to any kind of trauma, like being hit by a car or being attacked by a dog. The other benefit of keeping your cat indoors is it helps minimize the risk of them catching pink eye from another stray cat. If your cat has chronic upper respiratory infections and gets frequent pink eye, it's worth minimizing the stress in your cat's life because oftentimes stress will make herpes virus recrudesce. I know those are fancy words, but think about when you get really stressed out. You may get a cold sore on the corner of your mouth. And then 10 years later, when you're really, really stressed again, that herpes virus will recrudesce and come out again as a cold sore. So stress can definitely make viruses come back and show clinical signs. So how do you minimize the stress in your cat's life? Some simple ways are if you're going away for a weekend, please don't bring your cat. Your cat typically doesn't want a weekend road trip. It wants to stay at home, lounging on the sofa with a pet sitter instead. Try to minimize the amount of times you take your cat to a groomer. Now, some cats travel really well, but the majority of cats out there want minimal stress. If you have a lot of family members visiting since the holidays are approaching, try to keep your cat in a quiet room away from the busyness of what's going on. So maybe their own litter box, their own food and water, in an upstairs bedroom that's away from all the noise. Those are simple ways that you can reduce stress in your cat's life and hopefully help minimize conjunctivitis. There are some drugs that we can use, and some of them are natural supplements or even natural pheromones like Feel Away that can minimize stress in your cat's life. So when in doubt, talk to your veterinarian about that. Thankfully, the prognosis for pink eye in cats is good. Fear not, it's totally treatable. But the bad thing is it's very, very, very contagious. So please make sure to keep your other cats away because we don't want your other cats to get pink eye either. Just be aware that your cat can potentially get pink eye again if it's not completely treated for the full duration or if it's from a herpes virus that recrudesces, in other words, hides in the body and comes out during times of stress. When in doubt, talk to your veterinarian or your ER vet if you think your cat has pink eye and get to the vet right away because the sooner we treat it, the sooner it'll go away and we don't want your cat to be in discomfort. Well, that brings us to the end of today's show. Find me at drjustinelee.com, on Facebook at Dr. Justine Lee, or email me your pet questions at drjustine@petliferadio.com. With that, we're out of time, and we want to thank our producer, Mark Winter, for making ER Vet possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.